So we are going to learn everything. Yeah. So it is 15 May 2021. 15 May 2021. So this is today's date. This is the case notes, Eleanor Bennet. In the first 5 minutes, what you are supposed to do? In the first 5 minutes, what you are supposed to do? This is called pre-writing stage. So you have three different stages. You have three different stages. So you can take this total 45 minutes you have. In this 45 minutes, you take 5 minutes. 5 minutes. Okay, 3 minutes. So pre-writing stage. Then you have while writing stage. Then post-writing stage. So you have to separate your times like this because I'm a teacher trainer. I teach teachers how to teach English. So I'll give you the best. Pre-writing stage, that is this 5 minutes. That is reading. Okay. 5 minutes. That's what we have. Okay. Then while writing stage. This is how much time? 30 minutes. You have to finish in 30 minutes. Then checking. So 40 minutes we are dividing into two parts. 10 minutes for checking. So you have to finish writing in 30 minutes and check in 20 minutes. So this 40 minutes I have broken into two parts. So pre-writing is planning, the 5 minutes. You should not touch anything. You should not underline. You should not do anything. Just a plan. Then afterwards, 30 minutes for writing, 10 minutes for checking, post-writing stage. Okay. So that is how you have to plan. So first in this 5 minutes, what you are going to do, so mentally you have to be ready with all these things. What is important? So today's date is this one. Today's date, this will go there. And assume that today's date is 15 May 2021. You have been Miss Bennett's GP. So you are the GP there. You are the general practitioner. Don't write doctor when it is given GP. Write GP. When it is given doctor, write doctor. If it is given resident doctor, write resident doctor. Like that. And whatever is given, that only you have to write. So you have been Bennett's for 2 years. You have been treating her for 2 years. Remember that. And have been treating her recently following her hospitalization for cardiac problems. So hospitalized. Okay. You are treating her recently following her hospitalization. So treatment is under progress. Treatment is under progress. Have been treating means going on. Going on. Okay. Going on. So treatment is going on. Now, personal, Miss Bennett's GP, personal doctor. Okay. Right. Now let us see. The name of the patient is Eleanor Bennet. Date of birth is this much and age is this much. So this age can go into the introduction and this one can go into the subject line. Mrs. Eleanor Bennet, 6 December 1975, like that. Okay. Miss Bennet, Miss Eleanor Bennet, 6 December 1975. This is date of birth you can write. And in the introduction, you can write who is 45 years old, like that you can write. Now, so she is divorced. So you cannot write Mrs. She is Miss. She is divorced and she has two daughters. Okay, fine. Now 18 and 16. 18 and 16. She is taking care of them now. Now coming to the point, what are you supposed to do? This is a referral letter. This is a referral letter. And you are writing the referral letter to Dr. Banerjee. And this is not important. The full name is Dr. James Banerjee. Dr. James Banerjee. Okay. 1 minute. Yeah. Now I will show you how you have to Focus, all these things. So now here, address your letter, full name, Dr. James Banerjee. Focus this one. This is more important than this one. This is only half name. Dr. Banerjee is half name. So don't focus on that one. Okay. So this you can ignore. So Dr. James Banerjee, consultant. This is second line. Consultant cardiologist, second line. Sanditon City Hospital, third line. Sanditon, fourth line. So Dr. James Banerjee, consultant cardiologist, Sanditon City Hospital, Sanditon. So these are the four different lines that you are going to write in this letter, particular letter. Now this is a referral letter. You have to remember, write a letter of referral. You are writing a referral letter. Referral is here. Here also you will know that this is a referral letter. How do you know that this is a referral letter? In the writing task. Here in the writing task, you know that this is a referral letter. Here also you know that this is a referral letter in the plan. Okay, plan. What is the plan? Referral to cardiologist. So you are writing to cardiologist, consultant cardiologist. Why? Regarding. Why means purpose. This is the purpose. Regarding review of medications. Number one. So purpose number one is review of medications, and purpose number two, ways to encourage lifestyle changes. So lifestyle modification, medication, review of medications, and lifestyle modification. These are the two things that this doctor, that is Dr. James Banerjee, who is a consultant cardiologist and is in City Hospital, Sanditon, he has to bother about these. So you are giving two jobs to that Dr. James Banerjee. One is this Dr. James Banerjee should review the medications because the medications are not effective. There are side effects of that medication. That is what the patient thinks. That is what the patient thinks. So you are sending for a second opinion, you can say, because the patient is thinking here. So you can that we'll see later. So two options here. Now here also it is there. Dr. James Banerjee, consultant, in your letter briefly outline Miss Bennett's history and treatment so far, requesting advice. So what is the advice? Advice regarding lifestyle changes and a review of medication. Review of her, requesting advice. Requesting advice for what? Requesting advice for what? For lifestyle modifications. And a review of her medication. What medication? Cardiac medication. Okay, review of her cardiac medication. So these are the two things you have to notice. This is very, very essential. So what is important that we have noticed here? Next. So how are we going to find out the other important things? So now, right, listen here. Presenting complaint, 15 May 2021, recently. 15 May 2021. Okay. So 15 May. Today's date is 15 May 2021. That's the last visit. Now we are sending the patient to this doctor on 15 May 2021. So now medical history. She has joined recently with you and she's going on with this treatment. February. Okay. All this continuation going on. But so discharged, right? Emergency hospital admission, discharged from Oakville Hospital. So all these points, you have to notice what is important. Father died due to heart disease. Remember this. Father died due to heart disease. So, right. Now let us take the, what else we have to do? There are 5 different aspects. What are the 5 different aspects you should know? Right. For example, we should study. Many people don't know. They just want to write the letter. But I'm going to show you that one which is very, very important from the official online materials, oet.com. oet.com. So from there, I'm going to show you what OET people require from you. What you are expected to. Just writing some letter is meaningless. So what you have to know about writing guide. Just check writing guide. Okay. Writing guide. OET writing guide, this one. Organization and layout, genre and style, conciseness and quality, content, all these things, purpose. These are the 6 items. So we are taking the complete guide now first. So OET writing guide, we have, okay, writing guide. Here it is. This is the writing guide. Now let us see. Okay. Writing guide is already there. Okay. Yeah. So writing medicine. Yeah. Let me save it here. Yes. Yeah, this is the writing guide here. So this is the official writing guide. Many people won't show these things to you. They just tell blah, blah, blah and leave it. No, we are bothered about 5 different things. See here. Okay. Purpose is number 1. Content is number 2. Okay, these are the 5 different things. Purpose, content, then conciseness and clarity, 2 things in one. Then genre and style, 2 things in one. Then layout, organization and layout, we can call it organization and layout. Then next one, language. So these are the 6 things. 1, 2, 3, 4, 5, 6. For purpose, you have 3 points. For all others, 7 points. 3 plus 7, 5 are 35. Total 38 points. So you'll be graded for 38 points. 38 points, if you get, you'll get 500 marks. That's the point. So based on these things, now we'll go to purpose. Okay. We'll go to purpose. What is purpose? So 2 parts purpose. The purpose is of 2 parts. Try to understand how to identify and understand purpose, how to show purpose in your writing. The purpose is shown in the introduction. So immediately apparent. The purpose should be immediately apparent. Okay. Yeah, I will come to you there. So immediately apparent and sufficiently expanded. So first one, you should tell the purpose and you should expand the purpose. Purpose should be very clear. The first part of the purpose is making the reason for the letter immediately apparent. That means in the introduction, you have to write everything clearly. Then you have to expand the purpose in the continuation of the letter. So in the second, third paragraph, in the first paragraph, that means you should expand on this overview at the end of the letter by including additional relevant details about the reason for writing. So these are the 2 things. Okay. Now write a letter of referral to Dr. Smith, an endocrinologist at City Hospital, for further management and Mrs. Sharma's sugar levels. So this is the point. Now thank you for seeing Mrs. Priya Sharma. Referral letter. I am writing to refer Mrs. Priya Sharma. I am writing to refer Mrs. Priya Sharma, a type 2 diabetic, for further management of her blood sugar levels. For further management of her blood sugar levels. This is the purpose. So you have to write very. Now expanding this one in the, using the information given in the case notes, write a letter. So now you have to expand this one in the body paragraph, how it should be done. So all this information related to that will be given, fasting blood sugar levels, all these things. This will be given a clear picture of how to expand this one. So these are the 6 different. These are the 6 different. Yeah. So now let us see this one. Yeah. So that is next one. That is purpose. Then next one, content. Content means what is the relevant information that we write. So you have to choose the content. What is relevant information? You must include the relevant information. You must include the relevant information. You have to. There is no excuse. Okay. So let me explain these points. Okay. Yeah. First one is purpose. Purpose will be 3 points. Okay. 3 points. So total for writing, you will have 38 points. Total writing points. Okay. 38 points. Okay. 38 points. Okay, fine. Then next one, second one is content. Content, you have 7 points. Okay. Now let us see content. Yeah. Next one, content. So there are three types of content. First one, what is relevant information? Okay, what is relevant information and what is irrelevant information? So it will be very clearly given, case notes letter. So what is given in case notes, that you have to write. How you are going to write? See here very clear. Atorvastatin, Lipitor 20 mg, 1 main, added glipizide 5 mg, 2 main. So what is this? This is the notes. And you have to convert and transform it into letter here. Glipizide 5 mg taken every morning. Main means morning. Okay, every morning, daily. Okay, every morning will be added to, this is added. Added to what? Atorvastatin 20 mg also taken in the morning. Both taken in the morning. So this is how you have to present it grammatically accurate. So what is the content that you are taking? What is the information that you are taking? For example, patient moving to Centerville to live with the daughter and her husband. So Mr. Dunbar, so patient, don't write the word patient, write the name of the patient. Mr. Dunbar is moving, is relocating, changing the location to live with daughter to Centerville to be nearer his daughter and son-in-law so that they can take care of him. So how you are transforming this information in the letter is very important. That is point number one. And point number two, medication. Point number three, what are the recommendations? Now under surgeon's recommendations, you will see recommendations plan. A patient not to mobilize left arm until last week plain plaster removed. So not to mobilize. So how are you going to hear? Mr. Spencer has been resuming use of his left arm since last week following the surgeon's recommendations. So here patient not to mobilize left arm until last week when plaster removed. So this one you have to write in a full sentence. So this is very important. This is a recommendation. This must be done. It is a compulsory thing. So you have, so this is called relevant information which you are transforming into a letter. So Mr. Spencer, the name of the patient, has been resuming use of his left arm since last week following the surgeon's recommendation. That is what you have to write. So this is what is content. How would the reader feel at the end? Will the reader know what they need to do and continue care? So what they need means relevant information. You have to give the relevant information. Do they have the right information? Right, exact information, not wrong information, exact information, correct information, or absolutely correct information. Yeah. So this is official paper. It's not changing the meaning. Okay. It's not changing the meaning. It's actually what they have done based. This is surgeon's recommendations and what they have done already. It's not changing the meaning. What they have done already and they are reporting. They are just reporting what surgeon recommended they are doing. Okay. What surgeon recommended they have already done. Okay. Yeah. So next one. Now third one is right information. Okay, right information. Then next facts, all the facts, truths. Okay, all the truths should be provided. So that is second point. Then the third point, oh no, we are not going deep into the letter now. Just I'm giving you the important things. Okay, there are mistakes. Okay, maybe mistakes are there. Those, what is the mistake, what is right, all these things are explained here. Okay, why it is right, why it is wrong. We are not going deep into that one. We are only, so third one is, now the third point is conciseness and clarity. Conciseness and clarity. Concise and clarity, 7 points again. Conciseness and clarity, 7 points. So that is one. This is first one. This is second one. This is third one. Then we have fourth one. Fourth one. Yeah. Conciseness. Conciseness means what? Brief. Don't write too much. Don't write too much. Concise, brief. Brevity is the name of the game. You are not supposed to write too many things. That's the point. Conciseness and clarity. Whatever you are writing should be clear. Clear information should be given. Okay. Clear information should be given. So don't group similar information, different places. Now, including information not needed for care. So what is not needed should not be written. So irrelevant information should not be written. That is how conciseness will be there. Including too much history, too much past history, don't write. That's unnecessary. Because current problem, present problem, you don't need past history too much. What is relevant, you write that one. Then not grouping similar information. For example, medications. All the medications should be put in one place. Okay, based on the situation. So don't put in two different places. And in the same way, all the discharge plan, for example, you are writing a discharge plan. Discharge plan information should be written in one paragraph. You should not write a scattered in first, second, third, fourth paragraph. Everywhere you should write. No, you should write accordingly. What they have to do after a discharge, you have to write in the last paragraph, discharge paragraph. You are not supposed to write during hospitalization. So don't mess up the information. Group all the related information, similar information in one particular paragraph. That's what it is. That is called, okay, conciseness and clarity, so that the other person can understand very clearly. Right. Next. Fourth one, genre and style. Genre and style. So genre and style, 7 points. Genre and style, 7 points. Okay, what is genre and what is style? So what is the style of your letter? Organization of the letter. Is a formal letter or not? What is this type of letter? Formal letter. Formal letter means official letter. You cannot write as if you are writing to a friend. You cannot write this letter as if you are writing to a friend or a relative or a cousin or somebody. No, you cannot write. You have to write it in a formal style, official style, because anybody, okay, in the position as a doctor or a practitioner, okay, you are writing this letter. So it should be very formal, okay, not informal, not semi-formal. It should be perfectly formal, okay. No need to say good morning, good afternoon, good evening, all this. These are casual meetings. So this is not like that. This is formal, up to the point, because doctors are very, 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 very busy. They don't have time to all the other, okay, things. Subject is important. Subject is important. What is there, that only you have to write. Remember that. Then how to use the right level of formality and tone for the reader. Tone. What is the tone? For example, you are a senior surgeon and you are writing to a doctor. It should be official tone, official formal writing and official tone. So what do you mean by this one? You should not be, demanding or commanding. You should not be even requesting. Just passing on the information type of tone. You should not, that feelings apart. No feelings here. As it is. Whether you are talking to a nurse, you are writing to a nurse also, you should respect the other person. That is called the tone, formal tone. Tone should be neutral, not negative, not positive. Positive tone means aggressive. Negative tone is aggressive tone. Okay, aggressive tone, negative tone. Positive tone is over pleasing. Okay, over requesting. No need too much request. I request you kindly, please, please, please. All these things, no need. Okay, no need to impress the other person. You should write as if you respect yourself, you respect the other person also. That's it. Mutual professional respect. No need to be afraid. I am a nurse, I am writing to a doctor. Too much respect, no need. The other person also is an officer. This person is also an officer, nursing officer or medical officer or whatever it is. A professional respect, we can say, professional standards. So that is the tone you have to. You should not look down as a nurse. You should not look up as a doctor also. So all are equal here. Without a nurse, doctor cannot do anything. Without a doctor, nurse cannot do anything. Even social worker, if you are writing, you should give her respect. Whatever it is due to her, that is called the tone. You should not be like commanding. I am a doctor. I am telling you, you must listen. This is must. You have to do it. No, you should say. You should not say you have to do it. Don't say that tone. That is very, commanding tone. So give medications regularly on a daily basis. No, give means it's like an order. It's not like a request. Please give. No, this is very too much request. So tone, what is the tone? Tone means, is it a request tone or a commanding tone or an ordering tone or an aggressive tone or a bending down tone? No, all these types don't want. Be very formal, standard, professional standard. So keep it like that. The other person is also a human being, and I am also a human being. The other person is a professional. He's also he's helping me, and I am helping me. It is mutual give and take, like that tone you have to keep always for your reader. He should feel, oh, doctor gives me importance, so I will definitely do that one. Anybody should feel like that one. So that is called the tone, which the reader, he should not feel down, he should not feel up also. You should not praise him, you should not degrade him. Okay, the same tone, how you talk to your colleague, respect, give the same mutual respect to, as you are talking to a doctor, or you are talking to a surgeon, or you are talking to a dean or a registrar, or anybody. Okay, lowest employee to the highest employee, the tone should be the same here. That is what I am saying, right level of tone. Okay, but subject you give clearly, so you cannot say like this, what, give this medication every day morning. Give this medication every day morning. That is like an order or a command. If you say, please give this medication, it is a request. You should not request. You should not even command or order. Then how should it be? How should it be? For example, let us take the medication. What is the medication? Let us check the medication here. Dietary compliance is recommended. Finish. Dietary compliance is recommended. So try to understand this. What is important? Dietary compliance. That is important. So write about that. Don't give import. I am telling you to give this medication. I am telling, why I am telling you? You have to follow me like that. No, it should be very straightforward. What is important? Dietary compliance. Mr. Dunbar's medication and dietary compliance need monitoring. See how excellent it is. How excellent it is. Mr. Dunbar's medication and dietary compliance need monitoring. That's it, simple. So you are not telling comply with medication, comply with the diet. No, you are not telling as an order. Please comply. No. Mr. Dunbar, medication compliance need monitoring. Okay. Try to understand that one very clearly. So think about all these points. 2 milligrams, 2 mg daily morning is required, is advised. So try to use passive voice as far as possible. Okay. Need is not an order. Okay. Need is not an order. So better take passive voice. So what is important in this particular sentence? That only you talk. So who is important? Give medication means I tell you to give medication. I tell, I no need, you also no need. Medication should be given. Finished. Medication is important. So make it the subject of the sentence. That is what is told. So I advise. So many doctors write like this. I advised. So give some medication name. I advised. What is this? Let us take some medication here. I advised or I recommended. You'll say, right? Some medication. Okay. Glucose levels, Mr. Shaman comments on. Okay, for example, let us take, I advised some medication. I advised medication, some name. So let us imagine any name you can say. So now I advised medication to Miss Bennet. Now here, now what I'm telling you, tone, let me tell you. I advised. Now here, what is important? I is important, or Miss Bennet is important, or medication is important? Now tell me, Jasdeep,
Medication, sir.
medication is important. I is not important. Miss Bennet is not important. Medication is important in this particular sentence, because everywhere from the beginning to the end, I am there. From the beginning to the end, Miss Bennet is there. But in this particular sentence, newly introduced thing is medication. So medication was advised. So medication was administered or recommended. Finished. That's it. So if you say I gave medication, so it means you are giving importance to you. If you are saying Miss Bennet uh, was recommended this medication, so Miss Bennet you are giving importance. So no need to repeat the name of Miss Bennet every time. No need to repeat your name every time, because it is already understood. Who is writing the letter? You are writing the letter. So need not say I every time. It is understood that you are only writing the letter. So you only recommended. In the same way, Miss Bennet, so you recommended Miss Bennet. It is about her. Subject itself, it is written regarding Miss Bennet. So no need to say Miss Bennet again and again. So if you say medication was recommended, that means it means I recommended and Miss Bennet was recommended. That's all. So the tone should be very clear. This is subject-centered tone. Subject-centered tone. So better passive voice. Okay, better passive voice. So you are not giving importance to the doctor, you are not giving importance to the patient, but in that sentence, what is more important, that one you have to give. So is that clear, Dr. Jasdeep? Right. So next one, fifth one, after genre and style. Then we'll go to fifth one. Organization and layout. Yeah. Fifth one is organization and layout. Now it will be very easy for you if you follow this style and go ahead. For this also 7 points. For this also 7 points. Okay. For this also 7 points. Right. So next. Now what is organization? Organization means what exactly you have to do. So in organization, we have to write in 5 paragraphs. First one is the introduction. Last one is the conclusion. First one is the introduction and last one is the conclusion. So try to understand this one very clearly. Right. So organization chronologically. What do you mean by chronologically? For example, if you are writing a letter, if it is an urgent letter, the chronology will be like this. Today's visit should be written first. Jasdeep Kaur, unmute, keep it unmute, please. Okay. So now urgent letter. The chronology will be after introduction, you will write today's visit first and previous visits next. But if it is not urgent letter, so first you will write the patient's history, then you will write the present treatment and management, and then you will write the discharge plan. So like that one. Or if it is normal letter, if it is a referral letter, first you will write the urgent letter. How you will write? First you will write today's visit, and second paragraph you will write the previous problems, and last paragraph you will write the histories. Okay, last paragraph you will write the histories. Then next one, if it is ordinary letter, first you will write the past history, second you will write the present problem, and last paragraph you will write the histories. If it is a discharge letter, you will write before admission, during hospital admission, then post-discharge. So first you will write about his past, his histories and everything. Then you will write what you are doing in the hospital. This is discharge letter. Na? First admitted. Before admission, what was his condition? Past histories. Everything about him. Okay. Everything about past. Then second paragraph will be, okay, second paragraph will be present. Present means now he is in the hospital. So in the hospital, what you are doing, what you are managing, how you are treating him, what is the medication you are given, what treatment you have given, what is the procedure you have done. So all these things and how he is recovering, everything will go in the hospital, the progress, how it is. So that you will write. And in the third paragraph, you'll write after discharge what they have to do, discharge plan. That means you have to manage these things. You have to take care regarding diet. You have to monitor exercise program. You have to follow up with the action plan. All these things will go into the third paragraph. So this is the discharge letter. Discharge letter, what the patient did in the past, what the present nurse or doctor doing in this hospital. Then last paragraph, what the other person who is receiving this letter should do. So that is the third paragraph. So you understood very clearly, Jasdeep?
Yes, sir.
In discharge letter, what you have to write? First introduction, last conclusion. Forget those. The 3 paragraphs, body paragraphs. First you have to write what the patient did before. That is past history. And what you are doing in the hospital in the second paragraph. And what the person who is receiving this letter should do in the third paragraph. Is that clear?
Yeah.
Is that clear?
Yes, sir. Yes, sir.
Okay. So that is regarding organization and a layout. When the person reads the letter, it should be very, very clear to him. Then the last one is content. Organization and layout. And next one will be content, language. Okay, first one content, last one language. So language, sixth one is language. Language also 7 points. So 7 5s are 35 plus 3, 38 points. 7, 14, 21, 28, 35. 35 plus 3, 38 points. So first attempt only you have to clear. That's why I'm telling you all these things. There are many doctors who write 3, 4 times, 5 times and fail and then afterwards struggle. I don't want you to. You are my regular student. I don't want you to go multiple times, 5 or 6 times. So first attempt only you have to clear. Okay.
Yes, sir.
First attempt only you have to clear. That's very, very important. I'll show you one example of my student. Okay. Nepal. Kathmandu, Nepal. Yeah. See here. This is Alinda Manandar from Nepal. Okay. Alinda Manandar. She got 450 in speaking, 410 in listening, reading 400, writing 350 only. Try to understand this one. How difficult writing is. Okay.
Yes, sir.
Jasdeep.
Yes, sir.
You understand here what I'm saying?
Yes, sir.
So 450 she got in speaking, 410 in listening, 400 in reading, and 350 in writing. So how difficult it will be for writing. So lot of words are there. Anywhere you may lose your marks. So you have to be very careful. This is her results. See here. 350, very low in writing. So speaking very high, moderate, 400 and 410. So this is how my students get the results. So you also should get excellent results like this one.
Yes, sir.
This is Nisha Sharma. Okay. She got 370 in writing, 390 in speaking, listening 420, reading 430. This is my student, Nisha Sharma. So this is SS means our registered names, our students. SS means 7 sentinels, our regular students. So that is what she joined for our classes, and this is what the scores she got. So writing 370. See, least in writing. See here. So many students, they will face lot of problem in writing. So be very careful. Be very careful.
Yes, sir.
Okay.
Yes, sir.
So right. So you have to be very careful. So okay. I have many students who have got a very excellent scores. Very excellent score. Swati Nemade. This is another student, Swati Nemade, who got results. Swati Nemade. So her result was also somewhere. USA. USA. Results. Okay. I'll show you some other time. Right. So let us go further into the subject. So language. How are you writing language? Okay, vocabulary, punctuation, grammar. So it includes grammar, vocabulary, and punctuation. See here, grammar. Grammar should be excellent. Tense, passive voice, active voice, like that. Vocabulary, word forms. Try to use C1, C2 vocabulary. What do you mean by C1, C2 vocabulary? For example, I will give you now C1, C2 vocabulary. So this is Cambridge Dictionary. So many people don't know what is C1, C2 vocabulary. Do you know, Jasdeep Kaur, what is C1, C2 vocabulary? Did I tell you before? No, no? Okay. So now let us see here. For example, compliance. Compliance. Compliance is what type of vocabulary? So let us see. Comply is a C1. Comply is C1. Okay. C1 vocabulary. Use C1 and C2. Now let us say compliant. Compliant also C1. Now, assume is B2. But if you use assumption is C1. Now see, assume the condition. Assume the condition. Assumption is important. So if you use, instead of assume, you use assumption, you will get higher marks. You will get higher marks. Now, let me tell you what is this C1, C2 vocabulary. Now, again, I'll take you to, it's very important. Many people don't teach you all these things. Okay, I have to teach you. Now, here, I'm going to show you C, E, F, R levels, CEFR levels, and OET grades. Official OET. I'll show you from official OET, occupational English test, official OET. Okay. This is the point. CFR levels. Okay. You can go there. Council of Europe. CFR, Common European Framework of Languages, we call it. Okay. Common European Framework of Languages. So CEFR ratings. So what do you mean by CEFR? Common European Framework of Reference for Languages. So that is the table. Okay. So you have to know English. So now this Common European. So C1 means what? So this is very important. Okay. Very important. C1. C2, no difficulty. In anything, no difficulty. Outstanding results that it is. So this is called Common European Framework of Reference for Languages. So now OET occupation, what you need to know. OET grade B is equal to C1 level. See here. So this is official OET, okay? So you can check in all these websites. What is OET.com? So official OET.com. Okay. So here, benchmarking guide. Yeah, this is it. Yeah, benchmarking guide. So here, if you search this official OET, see here, this is official OET, OET.com, official OET. Here, if you check CEFR, CEFR, I'm writing here CEFR. So OET pulse, CEFR levels. No. Yeah. Okay. Benchmarking. Let me check there. One second. I'll get back to you there. CEFR. Benchmarking. Yeah. So here it is. Grade A is equal to CEFR C2. C2. Try to understand this one, what he's telling. Okay. So here it is. C2. C2 is grade A. Okay. Grade A. C2 is grade A. C1 is C1 advanced, B2 level. So these are the levels. Okay. So you have to verify these things. Edu benchmark. Yeah. Here it is. So C2, see here. If you use C2 vocabulary levels, you will get 450. Why my students are getting like this? This is it. Yeah, I told you. So C2, if you use C2 vocabulary, if you know C2 vocabulary, you will get 450 in reading, listening, writing, speaking, everywhere. If you use C1, it will be 350 to 440. That means you'll pass. You'll pass. 350 is the pass mark in writing or listening or reading or speaking anywhere. Okay. So you have to go through these things. C2, proficient user. C1, proficient. That means you are passing. Otherwise, you are failing. Okay. So focus on these particular areas. All right. So the last one is content. So follow all these 6 points. Out of 38 points, you have to write. Now we are going to do the test. We are going to go ahead with the planning. Let us take the writing task. So single page. Yeah, this is our answer sheet. This is our answer sheet. File. Yeah. File save as. So Bennet. Yes. Now we are saving this as Bennet. Okay. Organize pages. This is Control C, Control V. Okay, 4 pages. Let us take. Only 2 pages we'll be using, but wantedly I'm taking 4 pages. Okay. Now page number 1. Now in page number 1, you will start. Don't write here. Leave one line. You can start from here. You can start from here. Yeah, you can take break. No problem. It's okay. Right. So first let me start with introduction. Okay. First, let me start with introduction. Now, let us see what is the introduction. This is the introduction. Dr. James Banerjee. Okay. Copy text. So, Dr. James Banerjee. Here I will write Dr. James Banerjee. So, this is how you have to write. Right from the left last corner. Dr. James Banerjee. Yeah. So that's it. See from where I started. From the first dot. So Dr. James Banerjee. Next what? Consultant cardiologist. So consultant cardiologist. Same like that. Okay. Consultant cardiologist. No need comma, no need full stop, no need anything. Okay. Next line, you will write Sanditon City Hospital. Sanditon City Hospital. Yes, that is Sanditon City Hospital. And fourth line is Sanditon. Sanditon City Hospital is in Sanditon. So that's it, 4 lines. Now let us see anything is missing in the address. First write down the address because in every letter, no official letter, address will be in the first. Then only date. Many people write a date first. No, don't write date first. They will not tell you. See, this is an official sample. They will say, okay, okay, no problem. They'll say, okay, okay, no problem. Okay. They'll say, okay, no problem. But don't write like that because this is an official medical sample. When anybody can say anything, we don't bother. See officially what it is written. Which is first? Address first or date first? Date is next. Okay. Address is first. So follow that one. Dr. James Banerjee, consultant cardiologist, Sanditon City Hospital, Sanditon. That's it. So we have written 4 things. So first you will write the address. Then you will leave one line. Okay. Leave one line. Don't write in this line. You are not supposed to write in this line. Okay. You are not supposed to write in this line. Remember that. In this line, you are supposed to write the date now. You are supposed to write the date. Now, what is the date here? Check there. Go and check the date. So today's date is 15 May 2021. Here it will be there. Today's date. This is today's date. So copy this date and write here. Okay. Right. 15 May 2021. Write the date here. This is very important. Next is salutation. Salutation is you have to start with the dear Dr. Banerjee. So second name you have to write and you have to put a comma. Here comma is a must. Here you must write comma. Here you must write comma. Okay. So, okay, fine. I'll tell you, I'm coming there. Okay, I'm not unmuting you, but I will tell you why you have to write like that. Okay. Now here, what is here? For example, 6th December 1975. Okay, I'll unmute you, no problem. 15 May 2021. So let us see here. You have to write the month in full. Official letter is showing that you have to write in month in full. Okay. Not only this, take any sample letter, month will be written in the name. You should respect the name when name is given. Why do you want to give it a number? For example, your name is Jasdeep Kaur. So if I call you doctor, okay, maybe you will not like it because you have a special name. For example, you are a man, but your name is there. You have a name. So I should call you like, hey man, or I should call you by your name. Which is better? Man is for anybody. Man is for anybody, doctor is for anybody. But do you have a special name? Then I should call you by the special name. That is called formal. Okay. That is called the formal. If the doctor name not written, we just say doctor. Yeah, dear doctor. Yes, that's right. Absolutely right. Okay. You cannot say dear sir, dear madam. Sorry. When you know that doctor is a special name, you cannot say sir, madam. Okay. Dear doctor. You know that he's a doctor. You don't know that he's a doctor, then say sir or madam. If you know that he's a doctor, say dear doctor. First priority is name. First priority is name. Let me show you. First priority is name. Dear Dr. Banerjee. First priority. If you know the name, write the name. If you know the name, write the name. This is first priority, priority wise. If you don't know the name, dear doctor. Okay. If you don't know that also, then you will say dear sir. You don't know whether he is doctor or not. Then you will say dear sir or dear madam. You cannot write madam just for everyone. Okay. If you know Banerjee, write Banerjee. If you don't know Banerjee, write doctor. If you don't know doctor, then you write madam or sir. That's it. Is that clear? Yeah, your questions are genuine because many people say, okay, no problem, okay, no problem. Now here 15 May. If you write 15/5, so for example, 15/5, 2025. Okay, there is no problem here. But suppose this is 12/5. Then there is a confusion. In some countries, they will write months first. So it can be December 5. Okay, it can be December 5. That also is acceptable. Or it may be 12th May. Both are right because some countries write like that. So when you know the name of the month, better you write the name of the month. Okay. Yeah, it's not better. You must write like this. See all the official letters, it will be like this only. You want me to show 1 minute? I'll show you. I'll show you some official letters. All the official letters will be written like that only. Official online complete test. Okay. These are all medicine letters. Okay. Fourth letter. This is fifth one I have shown now, right? This is fourth. Response key. Okay. Reading parts, medicine, fourth response key. Yeah. So here it is. See here. 30 August. This is sample number 4. This is sample number 5. Month. Okay. Full month. Then sample number 4. August. See here. 30 August. He did not write A. 8. So I don't want to waste my time more. Okay. Not better. You must write month only. It's not better. Writing number is wrong. Because all the OET papers are saying this is formal letter. No, formal letter should be written like this, not writing like to your friend. It is very important, the month. So better write like this. For example, 5/5, 5/6. Is it July or June or May? Confusion will be there. Okay, because in some countries first month will be written, next date will be written. In some countries first date will be written. There are many situations like that. So don't get confused. Clarity is very important. So that's it. So next, so this is that letter. So you can see any number of letters. I'll show you one more letter. Okay. Third. So see here, this is letter sample number 3. Sample 3. Medicine sample 3. See 30 August. Okay. 30 August. So date it must be written like this. Remember. So I hope you understand what I am telling. Right. So that is finished. Next one, again, you will leave one more line. You leave one more line here. Okay. So next will be subject line. Subject line, that means regarding, colon, regarding and colon. You'll write regarding and colon space. So regarding and colon, regarding whom? Regarding who are you writing this letter? So first go here, Eleanor Bennet. Miss Eleanor Bennet, divorced. So you have to write Miss. If she is married, okay, you have to write, if she is in marriage, you have to write Mrs. She is married and divorced also. So it is Miss, not Mrs. Not Mrs. Miss. Miss Bennet. Miss Eleanor Bennet. So you have to write Miss Eleanor Bennet. Okay. Copy text. So Miss, here you have to write Miss space Eleanor Bennet. Then after that you have to put a comma. After that you have to put a comma. Yes. Yeah, you are right. You're right. Yeah. Next one, you have to write. Now here two things are given. One is date of birth is given. One is age is given. Now what are you supposed to do here? Here, if only date of birth is given, write date of birth. If only age is given, write age. If both are given, write a date of birth, because date of birth is more specific. Date of birth is more specific. So better you write date of birth. So DOB, okay, colon, 6th December 1975. This is how you have to write. For example, date of birth is not given. Then how you can write? Age is given. Then age. So you will write like this. Okay. So if date of birth is not given and age is given, then what you will do? You will say aged, how much? 45. Aged 45. Just write aged 45. Don't do any decorations. Aged 45. Okay. So you have to write like this. But you are not supposed to write like this here, because date of birth is already given. So give more importance to date of birth. Okay. Don't give importance to age if both are there. Right. So that's how you are going to write. Then next one will be introduction. First you will write introduction. This we will see afterwards in the second part after the break. We'll take a break now. Introduction. So that you will write the introduction. Then after writing introduction, okay, after writing introduction, you will leave one line. Okay. Then another line. So another line. So this will be in red. That means be careful. Red means be careful. So 5 paragraphs you will write here. Yeah. So like that one. Now let us see here. This is introduction. This is main, okay, body paragraph 1. This is main body paragraph 1. You'll write main body paragraph 1 here. Okay. Then here main body paragraph 2. So one by one you will write all these things. That we'll see afterwards in the second round. Next, the main body paragraph 3. Okay. I'm just giving the organization now. I'm not explaining the letter. I'm giving you the organization. How your letter should be. Address first, then date, then salutation, then subject line, then introduction, body paragraph 2, body paragraph 3. Then comes conclusion. The conclusion. So we finished the body now. Okay. Yeah. So the introduction, the body paragraph 1, body paragraph 2, body paragraph 3, conclusion. For example, this is discharge letter. Suppose discharge letter means first paragraph you will write before admission. Second paragraph you will before admission or upon admission. So what was his condition before that? Then body paragraph 2 you will write during hospitalization. Body paragraph 3 you will write post discharge plan, and conclusion, introduction. Now here you have to write closing remarks. Yours sincerely, because you know the name here. If you don't know the name, you have to write yours faithfully. But here you know the name, James Banerjee. So you will write here yours sincerely. If you don't know the name, and you will write dear to the cardiologist, or to the consultant cardiologist, or to doctor, or to the receptionist, or something like that. Just you don't know the name, you only don't know the professional name. You only know the professional name. Then what you will do? You will write yours faithfully. Okay, yours faithfully. If you don't know the original name of the doctor, okay, then you will write yours faithfully. But you know the name here. Okay, so yours sincerely. Then here leave 2 lines. Leave 2 lines. And there you write. So see here, why I am telling 2 lines? In even official letters, you have 2 lines. Okay. See here, 2 lines, leave 2 lines. Official letters, check all for official letters. There will be 2 lines because you will sign here. First 1 line normal and another line for signature. So 2 lines you have to leave here. Okay, signature and your name. Okay, at least 2 lines you leave. That's what is important. Okay, so leave 2 lines and write here. What you have to write here? So what is your name? Is your name given? Okay. Is your name given? Not given. Your name is not given. But your profession is given. What is your profession? You have been Miss Bennet's GP, means general practitioner. Write as it is. General practitioner. General practitioner. Okay. Right, like the general practitioner. That is very, very important. In this way, you have to write general practitioner. Okay. Here you have to leave 2 lines, I said. Okay, many people don't know. So I have shown you why you have to leave 2 lines. Okay. Why you don't put doctor? Because you did not say just a doctor. Here he has given GP. So write as it is in the case notes, no? Okay. General practitioner is different. Doctor is different. Doctor means any doctor. It can be any doctor. But general practitioner means your position. General practitioner can be doctor. Okay. Right? Even the registrar can be doctor, surgeon can be doctor, dentist also can be doctor. Anybody can be doctor here. Okay, doctor means general. General, anybody can use doctor there. Even an RMP can write a RMP doctor, something like that. So there are many things. Okay, anybody can write doctor, but here specialist also is doctor. Okay, general physician also is doctor. But here when you say general practitioner means that's very clearly is designating your position there. That is very, very important here. Okay, right? Dear doctor, you will say for anybody. If he's a surgeon also, you can say doctor. Dear doctor, finished. Doctor is a common name. Okay, but here he is telling you very clearly that you have been Miss Bennet's GP, general practitioner. Why don't you use it as it is? Okay. Some special name is there, na? You're not surgeon. If it is written, you have been Miss Bennett's surgeon, then why you want to write doctor? Write surgeon. Okay. General surgeon. Okay. Or orthopedic surgeon or whatever it is. What is your designation given? Write that one. Because this is very clearly given that you are a general practitioner. Okay. No, don't sign anything. Just leave it as it is. What is given? He did not ask you to sign there. Okay. Just leave it 2 lines. That's it. So, that's the point. Then next one, have been treating her recently following her hospitalization for cardiac problems. What is the name of the hospital? Okay. What's the name of the hospital? It is Oakville. Okay. Your general hospital there. So you are treating her there. Okay. So admitted into Oakville. Okay. Where is it written? Yeah. Discharge. Discharge. Emergency hospital admission. Oakville General Hospital. Try to understand this. So the name of the hospital is Oakville General Hospital and emergency hospital admission. That means accident and emergency A&E department. A&E department. Emergency hospital admission. Emergency department. Oakville General Hospital. You can write these also here. Okay. So many people think you'll get extra marks if you get, you are going to get extra marks here. So emergency department. So that's it. You know that he was brought in an emergency and you have been treating there. Okay. Yeah. So emergency department. So he was brought to emergency department and you are treating him there. You have been treating him in there. Okay. Then you discharge him. That's what you are writing. Okay. The next one. What else? Oakville General Hospital. Okay. You have been treating him there. And this is what Sanditon City Hospital. So you are sending him to city now. Okay. Sanditon City Hospital, Sanditon. And Oakville General Hospital. This is General Hospital, not special. And it will be in Oakville. Oakville. That's it. So write the full address, yours. So they should know everything clearly. So general practitioner, emergency department, Oakville General Hospital, Oakville. Why my students get more marks? Okay. There are students who got 420, 430 also. You can check in my Telegram channel, Grandmaster class. So these are the starters and these are the desserts. We have completed. These last two are the desserts. So let us see now. So these are the starters from here. So these are the starters from here onwards to here. These are the starters. Starters means before the main letter. Before the main letter. Okay. And this is the main course. Main course means you know what is main course, right? Dinner. You go to a hotel, you will get the main course. Okay. And these are the desserts, means after you will have ice cream or something like that. That is it. These are the desserts. So after lunch, after dinner. So this is dinner. This is before dinner, starters, to make your appetite grow. Okay. So that you will eat more. This is the main dinner or lunch or supper, whatever you call it, main course. This is the body. This is main. So we finished with the starters. We finished with the desserts. Now we have the main course, which I teach you in the second part. Okay. Right? Yeah, you have to write here only, last only. You cannot write before. Right? So this is how you have to present. Yeah, Jasdeep Kaur. Jasdeep Kaur.
Yes, sir.
Is that clear for you, dear Dr. Jasdeep Kaur? You said you are struggling with writing. Did you understand the basics of other than the body, everything?
Yes, sir. Now I got it, sir.
Then the second part, we will see the body of the letter, okay?
Yes, sir.
I'll have my lunch. Then afterwards, we can have the body of the letter. Is that clear?
Okay, sir.
Any
Yes,
doubts
sir.
do you have?
No, sir.
Everything clear?
Yes, sir.
I taught you about what is expected in the OET. 6 assessment criteria. Okay, I expected those things. I explained those things. What are the 6 assessment criteria? Purpose. Purpose will go into the introduction for 3 marks, 3 points. Then content. Content is 7 points. Then conciseness and clarity, 7 points. Genre and style, 7 points. Organization and layout, 7 points. Then language, 7 points. So total 38 points. That's what I told you. Then next one, I taught you about how to write the starters. That is, before that one, address, date, salutation, and subject line. Then finally, I taught you how to use the concluding remarks and the final sender's particulars. These are called the sender's particulars. So all these things you have known. And in the second part, post lunch, we'll discuss this body, how to write this letter. Okay, I'll tell you the timing. That time we can discuss this. Okay, after lunch. Is that clear?
Yes, sir.
Now, next, doctor. What's this name? Doctor's name? Doctor from Lebanon. Yeah,
Yes,
doctor.
doctor.
What's
Yes,
your name? I
yes.
forgot your name. Sorry, my dear.
Yes, it's okay, Gibran.
Gibran. Gibran. Okay.
Yes.
Zebra. Zebron. Okay.
No,
Zebra.
J.
Okay, fine. Zebra. I'll remember zebra. I'll remember you. Okay. Zebra. Yeah. Jebron. Sorry, yeah. I'm an old man, 55 years. Sometimes I forget names, and you are new
Yes.
to me. I cannot recall immediately. So I went deep into the subject and I forgot your name. Come on, tell me. How was the session?
It's very nice, very good. There's full details and everything. Um, really, I benefit from the layout because this new information about how you address the date of the letter and last for sentence general partitional emergency normally we put just a doctor and no خلاص we come on, but this is first time someone tell us no we put four.
Aywa.
Yes, I
Okay.
have I
Okay,
have a
fine. I
question.
will message you when I am taking the body. Okay.
Yes, just
Don't worry about anybody. I will not take too many students. Only serious people only come to me. You understand? Right?
yes, yes,
So
just
you can consider this session. Then afterwards you write the letter and I'll correct one letter for you. Okay? As I
yes, just
promised. Then afterwards you can
yes,
decide. Okay, if you are
yes,
regular and if you are serious, then only I will give you admission. If you are ready to change, if you want to get first attempt only clear, then only I will give admission. Okay, you understand? So first you prove
yes,
you are excellent and you want to clear in the first attempt only. You have to prove me. If I feel confident, then I'm definitely with you. Right. So welcome NH. Who is this NH? I don't know. So no problem. Afterwards, I will send you the link. So whoever is interested, you can join the sessions. So that's all for the first part of this letter. Okay. The first part of this letter, that is Eleanor Bennet. And the second part of the letter will continue later. Thank you very much. Have a nice day.